Knee pain or joint pain, one of the most common joint issues affecting millions worldwide. Welcome to WA Health and Care, your trusted source for reliable medical awareness in the UK and USA. Today, we're exploring knee pain or joint pain, one of the most common joint issues affecting millions worldwide. We'll uncover its causes, symptoms, treatment options, and natural prevention strategies recommended by leading orthopedic specialists. 1. What is knee pain or joint pain? Knee pain is one of the most common musculoskeletal problems among adults in the US and UK, affecting millions each year. It occurs when the bones, cartilage, or ligaments surrounding the knee joint become strained, inflamed, or worn down due to injury, arthritis, or overuse. According to Dr. James Gladstone, knee pain often develops from a combination of lifestyle factors, including poor posture, weak muscles, and repetitive movement without proper stretching or balance. Sedentary habits, obesity, and sports injuries such as ACL or meniscus tears are frequent triggers. Symptoms usually include stiffness, swelling, popping sounds, or reduced movement when walking, climbing stairs, or sitting for long periods. If untreated, mild discomfort can progress to chronic joint damage. At WA Health and Care, experts emphasize prevention through low-impact exercise, weight control, and anti-inflammatory foods like salmon, turmeric, and leafy greens. With early care and consistent strengthening, most knee pain can be managed effectively and joint health can be restored naturally. 2. What are the causes of knee pain or joint pain? Knee pain can stem from several causes, ranging from sudden injuries to long-term wear and tear. According to Dr. James Gladstone, knee pain is not simply a result of aging, it's often influenced by lifestyle, posture, and daily habits that place unnecessary strain on the joint. One of the most common causes is arthritis, particularly osteoarthritis, where the protective cartilage between the bones gradually wears away. This leads to stiffness, inflammation, and difficulty in movement. Another major cause, rheumatoid arthritis, is an autoimmune condition where the immune system mistakenly attacks the joint lining, causing swelling and pain. Injury is another major factor. A sudden twist or impact during sports or daily activities can damage crucial ligaments like the ACL, anterior cruciate ligament, or MCL, medial collateral ligament. Similarly, meniscus tears, which occur when the cartilage that cushions the knee is torn, are common among athletes or people who lift heavy objects without proper support. Overuse and repetitive stress can also lead to chronic knee discomfort. Activities such as running, climbing stairs, or prolonged kneeling can irritate the tendons and soft tissues around the knee, a condition known as tendinitis. Poor footwear, lack of stretching, and improper exercise form often make these issues worse. Obesity and weak muscles significantly increase the risk. Excess body weight adds pressure to the knee joint, accelerating cartilage breakdown and limiting flexibility. Meanwhile, weak thigh and hip muscles fail to support the knee properly, leading to imbalance and further strain. In some cases, infections or gout can trigger sharp, sudden pain in the knee due to inflammation caused by bacteria or uric acid crystal buildup. At WA Health and Care, we emphasize early prevention through strength training, healthy diet, and maintaining a balanced weight. Avoiding high-impact activities, using supportive footwear, and following a regular stretching routine can help protect your knees for years to come. Knee pain is often reversible if detected early. Small daily habits can make the biggest difference in your long-term joint health. 3. What are the symptoms of knee pain or joint pain? Knee pain presents through a range of symptoms that can vary depending on the cause, age, and activity level of the individual. According to Dr. David Altchek, one of America's leading orthopedic specialists, knee pain rarely appears overnight, it develops gradually as the joint becomes inflamed, strained, or injured over time. The most common symptom is a dull or sharp pain around the knee joint, which may worsen during walking, climbing stairs, or standing up after sitting for long periods. Some people experience stiffness, especially in the morning or after inactivity, as the joint struggles to regain flexibility. Swelling and redness are also classic signs, indicating inflammation or fluid buildup within the joint. You might notice warmth around the knee or a feeling of tightness that limits normal bending and movement. Another frequent symptom is a clicking, popping, or grinding sound when moving the knee, medically called crepitus, often caused by worn cartilage or early arthritis. In cases of ligament injuries, such as an ACL tear, patients often report a popping sensation followed by immediate pain and instability. Weakness or giving way of the knee can make it difficult to stand, walk, or carry weight. For chronic cases, symptoms might include joint deformity, persistent discomfort, or pain that disrupts sleep. At WA Health and Care, we highlight the importance of early recognition. Identifying these symptoms promptly and seeking orthopedic advice can prevent long-term joint damage and restore healthy mobility. Knee pain, when managed early, doesn't have to limit your lifestyle. Awareness is the first step to recovery. 4. What are the treatment of knee pain or joint pain? Knee pain treatment depends on the cause and severity of the condition, but most people can find relief with the right combination of exercise, diet, lifestyle adjustments, and medical care. According to Dr. Robert LaPrade, successful knee recovery starts with strengthening the muscles that support the joint, not just treating the pain, but restoring balance and mobility. Exercise and physical therapy. Low-impact exercises such as swimming, cycling, and walking are highly recommended. These activities help maintain flexibility and joint mobility without putting excess strain on the knees. Strengthening exercises that target the quadriceps and hamstrings, such as leg raises, wall sits, and gentle stretches, improve stability and reduce long-term discomfort. Physical therapy under professional guidance can also help retrain movement and prevent re-injury. Natural foods and diet support. Nutrition plays a key role in joint recovery. A diet rich in omega-3 fatty acids, found in fish like salmon and sardines, turmeric, ginger, and leafy greens can help reduce inflammation naturally. Vitamin D and calcium from dairy, eggs, and sunlight exposure strengthen bones and promote healing. Staying hydrated is also vital for joint lubrication. Medicines and medical options. For mild to moderate pain, over-the-counter anti-inflammatory medications such as ibuprofen, Advil, or naproxen, Aleve, can provide temporary relief. In more serious cases, doctors may recommend prescription NSAIDs, steroid injections, or hyaluronic acid treatments to restore joint cushioning. Topical pain creams and cold therapy are also effective for managing swelling and soreness at home. For patients with advanced arthritis or severe injury, medical experts like Dr. LaPrade often suggest minimally invasive arthroscopic surgery or joint replacement as a last resort, especially when conservative treatments fail to relieve pain. At WA Health and Care, we encourage early action through consistent exercise, anti-inflammatory nutrition, and medical consultation. Combining natural remedies with proper medical care can significantly improve mobility and quality of life. Remember, your knees carry you every day, so taking care of them means protecting your independence and long-term health. 5. What are the precautions for knee pain or joint pain? Preventing knee pain begins with consistent care and mindful habits that protect your joints every day. According to Dr. Jessica Martinez, the key to avoiding chronic knee pain lies in strengthening the muscles around the joint and maintaining a balanced, active lifestyle. One of the most important precautions is to avoid sudden or high-impact movements, especially if you already experience stiffness or weakness. Choose low-impact exercises such as swimming, yoga, or cycling to maintain flexibility without overstraining your knees. Always warm up before workouts and stretch afterward to keep your joints mobile. Maintain a healthy body weight. Even a small reduction in weight can significantly reduce stress on your knees. Wear supportive shoes that absorb shock and keep your posture balanced. Nutrition also matters. include anti-inflammatory foods like salmon, turmeric, and green vegetables, and drink plenty of water to support joint health. At WA Health and Care, we remind viewers that prevention is easier than cure. Listen to your body. If pain persists or worsens, consult a certified orthopedic specialist immediately. Taking small, consistent steps today can keep your knees strong, flexible, and pain-free for life. At WA Health and Care, we believe knowledge leads to healing. Knee pain can be managed effectively through exercise, healthy nutrition, and expert guidance. Don't ignore early symptoms. Your knees deserve care. Now tell us in the comments, which health topic should we cover next: back pain, arthritis, or joint mobility tips?